Hello, and welcome to the Better to Know HIV and STI, or Sexually Transmitted Infections, Counselling and Consent video. Getting tested for HIV or an STI can be a worrying thing to do, but it is often the only way for you to find out if you are carrying any infection. You can be carrying an infection and not know about it, as many STIs do not have any symptoms. Many sexually transmitted infections can be cured with antibiotics, but some infections, such as HIV, have no cure. It is important that you fully understand what you are being tested for, and that you also fully understand what it will mean if you test positive for HIV or any STI. This video is meant to provide you with the information you need to make an informed decision whether you should get tested or not, and it will also provide answers to many frequently asked questions about HIV. When you book an HIV test or group of tests which includes an HIV test, you will be asked to confirm that you have watched and fully understood this video, or that you have read and fully understood the HIV test counselling and consent document that can be found on our website. Just click on the HIV tests on the main menu bar and you'll find the document in the drop-down menu. If you want to get tested for HIV or any STI and book any test with Better to Know, you are agreeing and consenting to be tested for those infections that you are concerned about. You can withdraw your consent at any time up until you have provided your samples by simply telling us that you no longer want to get tested, and we will cancel any appointments made for you. Please watch this video very carefully and also download the counselling and consent document from our website. Make sure that you understand it well. By agreeing to the information contained in this video and on the form, and by booking a test with Better to Know, you are giving your informed consent to be tested for HIV, the human immunodeficiency virus, and any other STIs in the group of tests that you have chosen. If your HIV test is positive, additional tests will be performed on your sample to confirm or rule out HIV infection. You may be asked to provide an additional blood sample for these tests. If you are confirmed as HIV positive, that you will carry the HIV virus, you will be referred to a specialist who will advise on appropriate actions to follow and any treatments if required. If you test positive for any other STI, a doctor will be able to provide you with the necessary advice and a prescription for any medicines that you require. We will now answer the most frequently asked questions about HIV. What is HIV or AIDS? HIV is the human immunodeficiency virus. It's a retrovirus that can lead to acquired immunodeficiency syndrome, or AIDS, a condition in which the immune system begins to fail, leading to life-threatening infections we ordinarily would be able to fight naturally. Infection with the HIV virus may mean an increased risk of contracting other STIs. There are two types of HIV, HIV-1 and HIV-2. Both types of HIV will damage the body by reducing the number of specific cells called CD4 cells. Your body relies on these cells to help it fight off infections and other diseases. The numbers of these CD4 cells are reduced by the HIV virus, so you are not able to fight off infections as you normally would be able to. Infection with HIV occurs by the transfer of blood, semen, vaginal fluid, pre-ejaculate and breast milk. HIV can be spread by sexual contact with an infected person, by sharing needles and/or syringes, mainly for drug use, with someone who is infected, or through transfusions of infected blood. Babies born to HIV-infected women may become infected before or during birth, or through breastfeeding after birth. Having unprotected vaginal or anal sex poses a high risk for catching HIV. Getting HIV through oral sex, both giving and receiving, is possible. HIV cannot be spread by toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, shared clothing, or eating utensils. The majority of HIV infections are acquired through unprotected sexual relations. Complacency about HIV plays a key role in HIV risk. Sexual transmission can occur when infected sexual secretions of one partner come into contact with the genital, oral, or rectal mucous membranes of the other partner. Why should you get tested for HIV? Knowing your HIV status can protect your health and the health of others. Regular testing for HIV is therefore essential if a person has unprotected sex, that is sex without condoms, with someone of unknown HIV status, or if you think you have been exposed to the virus. The earlier you find out that you are infected, the better. Treatment for HIV infection is very effective, and if it is started early, before the body has suffered any lasting damage from the infection, most people can expect to live a normal and healthy life. Getting tested will also give you and your partners the information you need to manage your sexual health. Knowing your HIV status will enable you to protect others from infection. So what HIV tests are available with Better to Know? We offer 2 HIV tests. Our primary test is a test for HIV type 1 and HIV type 2 antibodies, and also the P24 antigen. This is a 4th generation test. The test is very reliable, over 99%, if performed 28 days or more after the possible exposure to infection. The second HIV test we offer is a test that detects the virus itself. This is a PCR early detection test, or polymerase chain reaction test, and it will detect the viral genetic material if present. You can have this test as early as 10 days after you think you might have been exposed to infection. So why can't I get tested immediately after I think I was exposed to the HIV virus? Many diagnostic tests have what's called a window period, or a time between possible infection and when the test will be able to accurately detect the infection. This window period is different for certain infections and also can depend on the type of test being performed. For HIV, the window period for the PCR early detection test is 10 days. For the 4th generation test, the window period is 28 days. What do I do if I test negative? A negative HIV test result means the test did not detect any infection with the HIV virus. You need to be sure that you did not test too early, before the window period was finished, as this can lead to a wrong result. A negative result is good news, but you should always consider carefully having another test 90 days or more after the last one to be certain of the result. This is good medical practice. What do I do if I test positive? If your HIV test is positive, Better to Know will do further tests on your sample to make sure of the result. You may be required to provide an additional blood sample, and we will contact you if this is the case. If you are confirmed as HIV positive, you need to be referred to a specialist doctor or centre for evaluation, further tests and treatment if required. Better to Know will help you with this. You will also be asked about your sexual partners or other people that you have had contact with that might have caught the HIV virus from you. It is very important that these people be contacted and that they are also tested for HIV. This is the only way to know for certain if they are infected, and if they are, they must be given appropriate medical help. So how is HIV or AIDS treated? There is currently no cure for HIV or AIDS. However, the condition is no longer considered to be life-threatening if detected early and properly managed by specialists. Indeed, people with HIV who take treatment will remain healthy and should have a normal life expectancy. Treatment consists of highly active antiretroviral therapy, or HAART, and advances continue to be made, improving both quality of life and prognosis. If you've tested positive for HIV, you must immediately contact your own doctor or specialist. If you think you might have been exposed to the HIV virus, either through a risky sexual contact, injury, or due to a condom break, post-exposure prophylaxis, or PEP, should also be considered. You should contact Better to Know or your healthcare provider to seek immediate advice. PEP is a course of HIV medication which you can take if you have been at risk of HIV infection. The course of HIV medication lasts 28 days, and if you start taking it within 72 hours of putting yourself at risk, it may be able to prevent you from becoming infected with HIV. How do you keep yourself and others safe from HIV? An infection with HIV cannot be cured, but you can do things to reduce the risk of catching the HIV virus. The virus can be caught from having sex with a man or a woman, it can be caught from sharing needles, or from any other activity where there is an exchange of body fluids from one person to another. To reduce the chance of HIV infection, you should always use a condom when you have sex. Make sure it is new, clean and undamaged. To reduce the chance of HIV infection, you should not share needles with anyone if you use drugs. Remember, practicing safer sex, using condoms all the time, and never injecting drugs is the best way to keep you safe from HIV infection. Thank you for watching this video. If you're happy that you've fully understood the information in this video, then please call our booking team who will be happy to arrange the tests that you need. Please remember that if there is any part of this that you do not understand, you must seek further advice before booking any tests. You can contact Better to Know by telephone or email with further questions, or to ask to see a doctor who can answer further questions for you before you decide to test. Thank you for watching.